Hi, it's Dr. David Greene, founder and CEO of R3 Stem Cell International. Today we're discussing stem cell therapy for cerebral palsy. So I'm going to go through how common CP is, the causes, traditional treatment options, stem cell therapy, the research available, and I'll tell you about R3's international program. So we'll discuss the U.S. for how common it is. Around 764,000 people in the U.S., including children and adults, have at least one symptom of cerebral palsy. About 10,000 babies are born each year with CP. Boys are diagnosed more often than girls. And CP is the most commonly diagnosed childhood motor disability in the U.S. Thankfully, over half of children with CP can walk independently. So what are the causes? Well, the brain damage that leads to CP can happen either before birth, during birth, within a month after birth, or during the first few years of a child's life while the brain is still developing. Now, we know the brain develops up until about past the age of 20, actually, but most brain development occurs in the first few years of a child's life. Congenital CP occurs before or during birth, and that's the bulk of what is seen, 80%. Acquired CP is brain damage that occurs more than 28 days after birth. Usually infection or head trauma is involved. So there are four main types of CP, including spastic CP, which involves increased muscle tone, and that's most common at 80%. Dyskinetic, which involves uncontrollable movements. Ataxic CP, which involves problems with balance and coordination. And mixed. So traditional treatments may involve medications, which could be baclofen, anticonvulsants, Botox, stool softeners, sleep aids. Surgery can help release contractures and reduce spasticity and hence increase a child's flexibility. Now, additional CP therapies may include energy therapy, movement therapy, physical therapy, mind-body techniques, aquatherapy, as well as what we're going to discuss now, which is stem cell therapy. So stem cell therapy for CP has increased in popularity as more research studies have come out showing its benefits. Anecdotally, in our center and internationally, we've seen tremendous benefits, just like those studies. And also it's gotten more and more popular since we found out that to get the stem cell therapies, children don't need cross-matching or HLA typing. Cell counts, we're finding out, are very important. You'll see that in the next few slides. Procedure options for stem cell therapy may include autologous, which is a person's own bone marrow or fat, or allogeneic, which means it comes from somebody else, either umbilical, amniotic, or what we call, postnatal tissue. And allogeneic with umbilical cord stem cells is turning out to be the most common. So what does the research show on stem cell therapy for CP? Well, I'm going to present a few studies. I'm not going to bore you to tears here, but let me just go through a few of them. This one was published in 2016. It's a concise review. It's called a meta-analysis, where they look at several studies at one time. So they looked at 5 high-quality studies, and the evidence indicated a statistically significant intervention effect on gross motor skills. So, and in those 5 studies, umbilical cord blood was the most effective, and they had rare side effects, even with no immunosuppression. Okay, we used to think years and years ago that if you got umbilical cord blood from a non-related, donor, that you needed some kind of immunosuppression to prevent a rejection. Turns out you don't need that. Here's a more recent study that involved 54 patients, and it was randomized, so half got stem cell therapy. They did a pretty decent follow-up of 2 years. The infusion group of stem cells received 4 infusions of umbilical cord blood, and this was a lot of stem cells. So if you look at the math, it ends up being around 200 million stem cells, and the results indicated that it was safe and effective in improving gross motor and comprehensive functions in children with CP. So tantalizing results from that study. So here's another one that is actually a little bit older. It was 8 kids with CP treated with umbilical cord blood. None of the children had any rejection issues. All of them showed improvement in mobility and cognitive function. 6 of the kids improved in muscle tone, hip movement, leg movement, and other things you see there. So this was a pilot study. It wasn't a huge numbers, right? But very encouraging results. So I do want to point out that, if when you look at the different types of stem cell therapy, there's embryonic stem cell therapy, induced pluripotent stem cells, and adult stem cell therapy. Okay? Adult stem cell therapy involves even the postnatal tissue. The term is a little bit of a misnomer, but the mesenchymal stem cells and hematopoietic stem cells. Embryonic and induced pluripotent stem cells are not ready for prime time, even by a long shot. All right, so if someone offers those options to you, I would run away because they're just not ready. There are problems with, for instance, with embryonic stem cell therapy, there's problems with rejection potential, there's problems with tumor formation. You just don't see either of those when you use the allogeneic stem cell therapy with the umbilical cord tissue that has a ton of mesenchymal stem cells, hematopoietic stem cells. You don't have to worry about that. So that's what we're talking about. Is people call it adult stem cell therapy. I kind of disagree with that because we're talking about the postnatal tissue, which is not from an adult. All right, so let's talk about the R3 International program. So we've combined all of the essentials for a first-rate program. All right, we have expert doctors who've done hundreds and hundreds of cases. You will receive a dedicated patient concierge representative. We have 2 locations in Mexico. For this program, patients go to Tijuana for that. Very safe biologics with extremely high cell counts. We've never had a significant adverse event in many, many cases. The location is only 20 minutes from the San Diego International Airport. I've made the trip myself many times, so I know exactly that that's the number. And it is the most cost-effective program in the world. So we offer options for patients to get either 30 or 50 million cells at one time, and that starts at either $29.75 or $39.75 for the 50 million. Now, most patients with CP are going to require a lot more cells, all right? So we have 2 options for that. Patients can come down with the family for a 5-day stretch, and that starts at $89.75, all inclusive. And the patient will get between 150 to 200 million stem cells during that time. It goes by weight, so our doctors will figure out whether it's 150 or 200 million. If a person wants to come several times a year, that's also available, and that would be 200 million broken up into 4 visits, and that starts at only $10,475 for the whole year. Amazing pricing. I would encourage people to go out and compare our pricing for what you get versus, say, Panama or other locations. So in Mexico, biologic culturing is allowed. In the U.S., you just can't achieve those very, very high numbers unless you use a ton of product because there's no culturing allowed in the U.S. So we work with GenCell. They're a lab out of Mexico City. They're accredited. They have a pristine safety record. Their quality assurance is actually more involved than what you see with the FDA in the U.S. They don't use any preservative. They don't need to. They have 95% viability, which is unreal. They do keep the cell culturing to the 5th generation or less, which is very important to know because it means those stem cells are very potent and viable. If you continue to culture and culture and culture cells, they will become non-functional. So most international labs do that, and then you end up with saying, "Oh, I got 150 million stem cells," but what you don't know is that 2/3 of those aren't able to do anything. Okay. Now, when you travel, some patients can drive. That's totally fine. But if you're flying, it's only 20 minutes from the San Diego International Airport. We do provide transportation from San Diego to the center and back, and you'll be escorted by the patient representative to the visits and the treatment. And we do provide travel logistics assistance if you need help with booking flights, hotels, things like that. So to get the process started, everybody has to have a free phone consultation with one of our doctors. And it may be Dr. De La Puerta. He is our Chief Medical Officer for R3 International. He's also our Chief Scientific Officer. And he's very passionate, compassionate, and knows a ton about stem cell therapy. He's done many, many cases. So just give us a call at 888-988-0515, and then visit us online at stemcelltreatmentclinic.com. We have articles about all these conditions. You can see a lot of videos, and we just want you to feel comfortable with the decision that you make for your family. All right, we've had very, very good outcomes, very, very high safety and quality assurance. And the area of Tijuana that the clinic is in is the Rio Zona, which is unbelievably modern and safe and everything. The clinic is very contemporary as well. All right, give us a call. We look forward to hearing from you.